Yes. So this idea that I call nourish your mood,
Mm-hmm.
mindful eating with the brain in mind.
Okay.
So this is an approach to leading us into a group kind of inquiry
Mm-hmm.
about thinking about what is it that would answer some of the questions that you were asking. You know, what is it as individuals and maybe as communities that can help support our brain health,
Right.
can help us have a mood that feels stable during the day,
Mm-hmm.
and also on a longer term basis, hopefully, and also keeps us healthy as we age.
Mm-hmm. Mm-hmm.
So you wanted to know about functional medicine. So
Yes.
functional medicine is an approach to wellness that is looking at what are the root causes of why someone doesn't feel well. Okay. So if you think about it, like if I fall down and, you know, one of these cords is here for the camera come out of here and, you know, somebody could fall. Hopefully that's not going to happen. I'm
Right.
not willing that to happen, but
Right.
you know, just imagining what's like a simple kind of easy to explain injury. You would
Mm-hmm.
know there was a cord, the person fell, they tripped, and then you could see, you know, the knee. So there's some things that happen to a person that are fairly simple and you can understand them.
Mm-hmm.
Chronic illness and long-term illness, it's not so clear. You can't look and say like, oh, I see that cord or I see what
Right,
happened. Sometimes I kind of, you ask me, why did I get into this? A lot of it is through my own healing and what I've tried for my own wellness, right? And sometimes I say, you know, this particular difficulty doesn't come with like a sign note that says, Dear Reba, this is coming to you courtesy of,
Right.
you know, what happened to you when you traveled to Guatemala in 1999, which
Right.
is actually one of the antecedents of some of my digestive concerns that I have, that I'm fairly certain of. But those are the kinds of things where you don't know, one doesn't know for sure, right?
Mm-hmm.
But the functional medicine doctors are trained specifically in how to think about it individually, right? Because a lot of medicine is saying a couple things. Like, first of all, let's look at the most prominent things that hurt, right?
Right.
So if there's pain, we
Mm-hmm.
try to make it less painful. If there's itchy, we try to make it less itchy.
Right.
Well, that's interesting, but why is a person itchy?
Right.
Or why are they in pain? And so with depression, with anxiety, the question is, why is depression or anxiety manifesting in this particular person's organism at this time in their life? And is the way that they will get well the same as the person next to them on either side, you know? And so we're looking at that there are common threads of what supports wellness, and we're
Right.
also saying that there's human diversity and it's not always the same answer for each person. There's a neat graphic they showed on the functional medicine website that showed, for example, if we're looking at depression and we see it as that there's a circle, and then it's almost like if you see a circle and then it has different spokes coming out of it with circles around it, and those are the outer circles are things that can influence or
Influence it,
impact it.
right.
And one of the main factors that very few doctors and therapists talk about yet that affect depression is something called inflammation. And we can come back to that.
Yes.
And then they also have
yes.
another graphic that has inflammation in the center,
Mm-hmm.
and then spoken out from there, it shows all the different things that might affect. It might affect depression and mood, and it might affect other things like how's the person's metabolic health, like what's going on with their blood sugar
Right.
regulation, or how does it affect their allergies, or how does it affect the pain in their body, right? So we're saying that the streams both in and out can differ and can be different between individuals, but that we can track them quite closely. And so we're not content. I like it because it's intellectually motivated and compassionate. We're saying, I care about the person in front of me and I want to understand them as an individual and understand what is it that's going on.
Yeah. Yeah.
And then the treatment within functional medicine is really looking at the whole palette of how to get to not only surviving, but thriving, how to be really, really well, and how to utilize some of the simple things that we just do on a daily basis,
Right,
like
right.
how to get more rest, how to get more sleep. Sleep and rest not always the same. Sometimes we can rest while we're awake, right?
Yes,
How
yes.
can we look at what we're eating as a really big factor. How can we have some movement in our life? And how can we be in community? You know, things about how to nourish a person in a way that's using nature as our ally.
Right. I think that that's really important. And what I hear you also saying is when you have this approach, there's not a one size fits all, because it's not.
No.
Every individual, you know, their DNA molecules are all different.
Right.
And so it's really important that when you're looking at and treating, you know, people that have different disorders, just as you said, that what may work for one doesn't work for the other, but at the same time recognizing that all of these, as you say, these spokes that are coming out, it's really important to understand that one spoke may stick out probably a little bit more than the other, but it's how do you recognize and identify what it is? And that's really important. And it's so interesting to hear you talk about, I have a sister who, if you didn't don't tell her any different that she has a PhD in holistic medicine, because
I won't tell her any
yeah,
different.
because her whole thing is she talks a lot about the inflammation that's within one's body, and people aren't even aware of what's really happening to them. So it's really interesting to hear you talk about that and have more of a focus around that as well.
We can define inflammation a little bit later if we want to, so to make that more clear. So functional medicine, those doctors, some of them are people who have an ND, M like Nancy, naturopathic doctor, and there are also people with an MD, M like Mary, who are conventionally trained medical doctors who are going back and getting more of this training because they're seeing results. And a lot of them, you know, so many of the people are people like myself. If I think about the people that I really look up to, Dr. Leslie Korn, Dr. Kelly Brogan, each one of these people is someone who had a journey that is like mine, where we were suffering.
Right.
You know, we had something, for me, it was, you know, years of chronic pain. And when I was having problems with my digestion, I was having so much trouble with word finding. I mean, I remember being in the pharmacy and I was looking for, I can't remember if I wanted a lamp or a fan, but I was confused between a lamp or a fan, you know, or I was at my friend's house and I said, can I put this in your compost facility? Like, I couldn't think of the word, just like, you know, bin or container, you know, bin, you know, so it's like when you lose your nouns, like people have an aging, I was having that when my digestion was upset. And I was like, it's so different reading about it in a book and experiencing that digestion brain connection. Dr. Leslie Korn, she went to Mexico, studied with indigenous women, and she got all the digestive upset, and the indigenous women also helped her heal. She went to them to heal, you know. And Dr. Kelly Brogan, another conventionally trained doctor who went through her own, you know, illness and her own depression, and each one of these people said, I have reached the limits of my paradigm. All the training I had, lots of these people are Harvard trained for his residency, really, really well trained. And they realized, wow, when my own brain is not well, I need to learn more. And that's when they started allying with food and nature and finding other ways for their own wellness. And then like me, you go through it and you think, well, it took a lot to do all that study. I might as well share it with others.